You also serve on the VA's National Diabetes Group. Why is diabetes awareness and education currently important for veterans in today's day and age?
Oh my goodness. I think that there are so many components to diabetes management, and really being able, and most of diabetes is self-managed. And having the education and the tools required for self-management are are of such importance. We want to avoid extremes. We want patients to be able to avoid extremely high blood glucoses and extremely low blood glucoses.
Yeah.
The risk of low blood glucose, the hypoglycemia, that loss of consciousness is actually very, very serious. And, if somebody is driving when that occurs, that can be very, very, very um, serious, life threatening,
Sure.
deadly.
Sure.
And we've all heard stories where that's occurred. So yes, we want to avoid the extreme lows, but with the extreme highs, um, those long-term complications, the complications of nerve damage and kidney damage and heart damage, they're very real. And by improving control, we can help reduce the risk of the long-term complications. And that truly is important for people with diabetes.
And you were saying that a quarter of veterans are being diagnosed with diabetes.
Correct.
That's an amazing number. Is it type 1, type 2, a mixture? Um,
So I think it's not a quarter of people with that are veterans have the diagnosis of diabetes, but rather 25% of veterans that receive care within the VA have the diagnosis of diabetes.
got you, got you.
So many veterans, receive their care in the private sector, but those that receive their care within the VA,
A quarter of
about
'em are
25% of them have the diagnosis of
I
diabetes.
mean, any way you slice it, that's an amazing number.
1 in 11 Americans actually has the diagnosis
Wow,
of diabetes.
wow. Say I just got, diagnosed with type 1 diabetes,
Yes, sir.
uh, and I'm with my VA doctor. What are some of the first steps? What first steps should I take in making sure I could start managing this correctly?
Your first step really is to work very closely with your primary care provider, and to use the monitoring tools that are available, to work very closely with the registered dietitian, and to explore the various technologies that are out there to help you best manage your diabetes.
Got you. Should I start making appointments with certain
I
specialists?
I I would make the appointment first with your primary care doc so that he or she can guide you to the appropriate specialist.
Okay,
Yes.
got you, got you. Now, what can veterans with diabetes, I mean, in your blog, you talk about this is my drill. What's your drill? What type of education is necessary for those with diabetes?
Yeah, we do have a diabetes self-management education and support program. And this is actually a program in which really individuals are are given 8 very specific educational topics.
And any
Uh,
veteran in the VA system can ask for this.
yes,
Okay.
so there's a diabetes overview, there's diabetes and monitoring, diabetes and shared decision making, diabetes and medication, diabetes and physical activity, diabetes and complications. And all of these are important topics for veterans to at least have an understanding of.
Uh huh. Interesting. Very interesting. Um,
From an access standpoint, we're actually in the process of building a virtual medical center, both the VA and the Department of Defense, which will allow patients access to the materials 24/7, 365 days of the year, so that they can do their own self-learning,
Not only them, or if they're
and their
if they're
family members.
yeah, if they're stubborn about it, their family members can get on there. That's
Yes.
cool. Great.
For places where they don't have a structured program, we have pharmacists, and many of the pharmacists really are stellar at providing guidance in medication management, medication education, medication titration. We are very, very fortunate to have an amazing pharmacy team. Nursing, we have many nurses that are also duly credentialed as certified diabetes educators, and a true asset to veterans with the diagnosis of diabetes. So, it's a very nice system.
Very good. In your blog, you talked about serving sizes, blood glucose before meals, carbohydrate to insulin ratios. Why do numbers matter? And are they different for each person? I'm sure a person's weight probably affects that number. I'm guessing.
You're absolutely correct.
Okay.
One of the things we really focus on is health literacy. And within health literacy, we look at, cultural components of health literacy. We look at, a person's ability to speak, a person's ability to listen to information. We look at a person's ability to read and write. With diabetes, we also look at numeracy. And numeracy is truly, just very important. If there's an error in numbers, somebody can really end up in trouble. And
Yeah.
again, I go back to how I met the Pope. Just the timing of medication and the timing when you're traveling or crossing time zones, being able to manage that correctly can really put somebody a, in jeopardy of a pretty significant acute event. Um, I am a registered dietitian, and the reason I became a dietitian again was because I was diagnosed with type 1 diabetes when I was in high school. And
Wow.
back when I was in high school, the tools that we had were very, very different than the tools that we have today. The insulins today are very different, but something like monitoring, it used to be just testing your urine. And it wasn't until the 1990s that, you know, blood glucose monitors became widely available to the public. So, right now, anybody that's diagnosed gets a blood glucose monitor. In the 1970s, from a nutrition standpoint, I think nutrition is something that has truly evolved. Back in the before insulin was discovered, Elliot Joslin was one of the doctors that treated individuals with diabetes, and he found that they had to have a very disciplined lifestyle,
Mm.
disciplined exercise, disciplined diet, and that if they overate, they would end up with very, very high blood sugars. But he did indeed, kind of instill that first focus on that disciplined lifestyle.
Think about veterans and discipline, and you hope that, hey, if some of that discipline's carried over from service, this is something that you should be able to manage. You know, but sometimes veterans drop that discipline as soon as they get out.
It's actually a very nice population to work with because they do have that history of discipline. And sometimes they just need to know, get that education on why this discipline is important.
Yeah.
Um, for me, once I learned, you know, again, monitoring was urine back in the 1970s. And many of our veterans were first diagnosed in the 70s or even 80s before, we had the widespread blood glucose monitoring and the
So blood glucose monitors, excuse me. Is that something that if you're in the VA system and you have diabetes, you can go and pick one up?
with the diagnosis of diabetes, you would be issued a blood glucose monitor.
Wow.
Yes.
Wow. Eating healthy. You always hear that when someone's diagnosed with diabetes. They always say, "Hey, you gotta watch your diet. What should you be eating? What shouldn't you be eating?" And veterans always got to figure out: is there a way to cheat the system?
What you should be eating is actually a very complex question. Um, you we have gotten somewhat away from the rigid discipline that had to occur back, you know, 50, 60 years ago because of more advanced medications. First and foremost, that weight, being within a target weight for somebody that's newly diagnosed with type 2 diabetes is very important.
Gotcha.
Exercise, also very important. We are There's metabolic benefits of exercise, and there's cardiovascular benefits of exercise. For metabolic benefits, it even if you walk for 5 minutes, there's a metabolic benefit to that.
Sure.
And so we want people to just start with a goal of getting up to 10,000 steps per day. That's when you really reap the metabolic benefits of exercise. Nutritionally, once we're in target weight, we can actually see the impact of various foods on a person's blood glucose.
You've heard about people that do more exercise and eat better. They actually can lower their insulin dosage. Is that true?
That's very true. It's very true. Exercise is very, very metabolically beneficial. And for some people, they can actually put their diabetes into remission if they have type 2 diabetes.
Wow. Wow.
Yes, through exercise and weight management.
Wow.
When we talk about carbohydrate insulin ratios, we talk about that for our patients with both type 1 and insulin requiring type 2.
Okay.
And
Very.
one of the simplest things that we start with is that 1 unit of insulin covers about 15 grams of carbohydrate. That is, so people have to understand which foods are carbohydrate, and they have to be able to quantify the amount of carbohydrate in, various serving sizes and also in mixed meals in order to appropriately dose their insulin, their mealtime insulin.
Wow. So you got to be really careful. So that's where it goes into the label reading and all of that. You got to
Yes,
understand
correct.